Thanks, Neil. It's a pleasure to see so many of you here today. Such a beautiful afternoon in Los Angeles. I know there are a lot of other things you could be doing. But I guess you're here today because you're concerned about heart disease. And well, you should be. Over 1 million unsuspecting people will die this year from heart disease, making it by far the #1 killer in the developed world. And I say unsuspecting because I've taken care of thousands of people who have had heart attacks. And every one of them is absolutely shocked that it happened to them. Because heart attacks happen to somebody else, even if I have all the risk factors and I don't take care of myself. Well, somebody dies from a heart attack every minute. Somebody has a heart attack every 26 seconds. Now, when I start talking about heart disease, I see some of the ladies kind of get that glazed look in their eye. Because after all, heart disease is what happens to men. Women die from breast cancer. We know that, right? Actually, nothing could be further from the truth. Not only do more women die from cardiovascular disease than from breast cancer, but then from all cancers combined. In fact, more women die from cardiovascular disease than the next 7 leading causes of death combined. So ladies, I think it's just as important for you to listen up as well. I was recently at a social event. This guy walks up to me and says, "Hey doc, I've heard a lot about you. I'd like one of your cards. If I have a heart attack, I'm going to give you a call." I kind of smiled as I gave him the card, but as he walked away, I got to thinking. I said, you know, what if that guy really did keep that card in his pocket and then he did have a heart attack? There'd be a good chance he would never even be able to get that card out of his pocket before he died. Because half the men and almost 2/3 of the women that die suddenly from a heart attack had no previous symptoms. The first symptom is they just die. And this is tragic because we now know that heart disease is 80% preventable. Yes, I did say 80% preventable. So we need to start looking for ways to help prevent, not just treat heart disease. And actually, when I treat a person that's had a heart attack, I know I've already missed the most important part of that treatment, the prevention part. I've seen just too many people after they've had their massive heart attack, after they're already in heart failure, after the heart stopped for a while and their brain's been damaged. And the reason I have such passion for such heart disease prevention is I've seen just too many of what I sadly call these Humpty Dumpty hearts. They're broken, and I just can't put them back together again. So if we're looking for ways to help prevent heart disease, we need to look at some of the major risk factors for heart disease and see how we can favorably affect them. Some of these major risk factors are high cholesterol, high blood pressure, obesity, diabetes, and smoking. Let's first look at cholesterol. There are, of course, as you know, different types of cholesterol. There's the LDL or bad cholesterol, HDL or good cholesterol. People say, I can't remember which one is which, doc. Remember L is for lethal. You don't want LDL cholesterol. H is for healthy. You want HDL cholesterol in your body. You don't want the LDL cholesterol because it's a sticky little molecule. It clings to the blood vessel wall and forms those plaques in the arteries that start to block up the arteries. They can become inflamed. They can rupture. A clot forms at that area of the heart. The blood flow to that part of the heart stops. That part of the heart muscle dies, and you have that catastrophic event, the heart attack. Now, for every 1% you lower your LDL cholesterol, you actually decrease your risk of heart disease by 2%. So it's really vitally important that we figure out good ways to reduce our LDL cholesterol. Now, HDL is just the opposite of LDL. It's the good kind of cholesterol. It's the healthy kind of cholesterol. It actually fights plaque. It actually takes the LDL cholesterol, binds it, and transports it harmlessly to the liver. So it not only fights plaque, it may actually help prevent disease, maybe even reverse heart disease. So it's also vitally important that we find ways, although it's sometimes really difficult, to increase their HDL cholesterol. Because for every 1% you increase your HDL cholesterol, you actually reduce your risk of heart disease by 3%. Now, I think we all know how we should lower our cholesterol. I think we all know that we're supposed to exercise more, reduce our weight, and watch our diet. We need to cut down on our cholesterol intake, our saturated and trans fats, and our refined sugars. And we need to increase our intake of fruits and vegetables and fiber. We all know that, right? See some people smiling. We all know that. The problem is that most of us just don't have the discipline to do it on a regular basis. But even if you did have the discipline and did do all those things, a lot of you would still have high cholesterol because of genetic factors. I don't know if you realize it or not, but only 25% of the cholesterol in your blood comes from what you eat. The other 75% is made by your liver. And a lot of times the liver just makes too much. So what do you do when that happens? Well, if you go to your doctor, he'll probably start you on one of these prescription statin drugs. Statin drugs are the most popular drugs in the world. In fact, the two top-selling drugs in the world are statin drugs, and they account for a $25 billion price tag every year. They lower cholesterol just one way. They decrease the production of cholesterol in the liver by blocking an enzyme. Do statins work? Yeah, they work pretty well. They lower the LDL bad cholesterol by an average about 32%. But they're not so hot at raising the HDL. They only raise it by about 7%. That's not so good. People always ask me, do I personally use statin drugs as a cardiologist? The answer is yes, sure. I use them all the time. I use them for many acute and chronic heart problems. In fact, I think it's mandatory to use statins in certain situations. But for healthy people that are just trying to lower their cholesterol, I think there are better ways. Why do I say that? Well, 10 to 20% of the people have difficulty tolerating statin drugs. If you actually looked it up in the physician's desk reference, you'd see several pages of potential side effects from the statin drugs. They work on the liver, so they can often inflame the liver. And you have to take serial blood tests to make sure that this doesn't happen. They can also cause muscle problems. Usually starts with just muscle cramps or muscle pains that shouldn't be there. It can progress to a severe problem in which the muscle fibers in the body actually are absorbed into the blood. They can travel around and cause a myriad of problems. I once saw an unfortunate man who had this kind of a problem. He had been started on a statin. He was a healthy guy in his 40s, just wanted to lower his cholesterol. When I first laid eyes on him, he was in the emergency room at our hospital on a ventilator. He was on a ventilator for a week. He had a stroke. He lost entire function of his kidneys and was on chronic hemodialysis. And this was just a young, healthy guy in his 40s that wanted to lower his cholesterol. It's important also to note that as the statin dose increases, the relative effectiveness of the drug usually decreases. For example, I saw a guy who had a high cholesterol and he was started on a statin, and the initial dose dropped his LDL by 50 points. It was still not enough, so the dose was doubled, but instead of lowering it by another 50 points, it only lowered it by 10 points, and he started to have muscle pain, a potential problem. This illustrates another problem with statins. As you increase the dose of the statin, the potential side effects increase very, very steeply, even though the effectiveness of the drug doesn't increase by that amount. And as the dose increases, you sometimes reach what we call the statin floor, which means that the cholesterol can't be lowered any further by using a statin, either because you've reached the maximum dose of that drug, or because, like the man I mentioned earlier, you reach a point where increasing the dose causes him to have symptoms. Now, when that happens, if you go to your doctor, what would usually occur is that you would start you on a second drug that lowers cholesterol by a different mechanism. And each of these drugs also has potential side effects. A lot of times these drugs can interact with the cholesterol medication, the statin drug, to actually compound those side effects. Now, one drug company actually put two of these medications together. And the CEO of the company was quoted as saying, "This is an innovative treatment and a major advance in cholesterol therapy." Well, if treating cholesterol in two ways is called an innovative treatment and a major advance in cholesterol therapy, what do you call something that decreases cholesterol in four ways? You call it BioSlife. BioSlife is a flagship product of the Unicity company. You know, to make life better, people. The original formula consisted of several types of soluble and insoluble fiber, mostly soluble fiber, with powerful antioxidants, and vitamins, and minerals, and trace elements like chromium. Recently, 3 new ingredients were added to increase the efficiency of this product in lowering cholesterol. And it became known simply as BioSlife. It's a powder. You mix it in water or juice and take it about 10 minutes or so before you eat. It forms a gel in your stomach. And then these ingredients act together to do some really terrific things. First, let me talk about the importance of fiber in BioSlife. If you listen to the American Heart Association, American Diabetic Association, they'll tell you that you should have 30 grams of fiber in your diet, but the average diet has what? Only about 12 grams. And soluble fiber is especially important because it binds cholesterol-containing molecules called bile acids. And it holds them, they're swept out of your intestines, and you thus decrease your cholesterol by this mechanism. There was a placebo-controlled double-blind study that evaluated the importance of this mechanism using BioSlife 2 at the Cleveland Clinic, which many people consider to be the best research heart center in the country. And this study showed that you could decrease LDL, the bad cholesterol, by about 11% just using fiber. And also there are harmful elements to the heart found in the blood with nasty sounding names like apolipoprotein B and homocysteine, which were also decreased by an average of 20 and 11% respectively, believe it or not. Fiber is also very important in controlling diabetes. There are 20 million diabetics in this country, and 6 million don't even know it. Diabetes is a very insidious disease, and very often serious damage can be done to the body before it's even diagnosed. Diabetics usually have vascular disease. In fact, most people with diabetes die as a result of cardiovascular problems. And poorly controlled diabetes is associated with a new set of problems, such as blindness and kidney disease and peripheral vascular disease. So it's extremely important to prevent these wide swings in blood sugar that we see so often in diabetics. There was an article in the New England Journal of Medicine that talked about the importance of soluble fiber in diabetics, and the study showed that indeed you can control those wide swings in blood sugar with soluble fiber, and also help to control the lipid abnormalities that are virtually always associated with diabetes. Soluble fiber actually decreases the rate at which the carbohydrate that you eat gets into the bloodstream. So it lowers the blood sugar, it keeps the insulin levels lower, and it actually helps control the diabetes much more carefully. It's been estimated that for every 10 grams of fiber that you increase in your diet daily, you decrease your risk of diabetes 30%. Dr. Peter Vertigan recently presented a study at the American Heart Association Conference on Atherosclerosis, and he illustrated the importance of this principle using BioSlife. In a 90-day study, he showed that BioSlife decreased the LDL cholesterol by 29%, increased the HDL by 22%. And others have shown a significant decrease in blood pressure and in hemoglobin A1C, which is really the hallmark of diabetic control, using BioSlife. BioSlife also contains a niacin-bound chromium compound. It's the most bioavailable chromium. And this has been shown to be important in carbohydrate metabolism, as well as for maintaining favorable lipid ratios. You also need to remember that fiber is very important in cancer prevention. A high fiber diet may significantly reduce your risk of prostate, colon, and breast cancer. And a high fiber diet may also reduce your blood pressure. But I said BioSlife worked 4 ways. The first one is obviously fiber. What are the 3 new ingredients and how do they work? Well, the second mechanism is with phytosterols. Sterols have a structure almost identical to cholesterol, but they're harmless, and they block the transport system of cholesterol. What does that mean? Well, let's suppose that there's a bus. Don't tell people there's a bus in your heart somewhere, but let's suppose there's a bus. And the bus actually transports cholesterol from the intestine into your bloodstream. Now, the bus driver only lets cholesterol on this bus. But the sterols look so close and so almost identical to the cholesterol that sometimes he gets fooled, and several of the sterols get on the bus and take seats. And there are only so many seats on the bus. That means some of the cholesterol can't get on the bus, so it's swept out of your intestine, and you thus lower your cholesterol. Fascinating mechanism. Third mechanism is with polycosanol, which is a sugarcane natural derivative. Polycosanol actually blocks the same enzyme in the liver that's blocked by the statins. That does this without any harmful side effects. And blocking this enzyme, of course, reduces your cholesterol level. The fourth mechanism is with a flower, Chrysanthemum morifolium. It's been used for centuries in China as an herbal tea. And it's been shown that Chrysanthemum morifolium actually enhances an enzyme in the blood which inactivates the cholesterol. So it also, by this mechanism, decreases your cholesterol as well. Recently, an 8-week study by Dr. Vincent Duenos using this new BioSlife formulation studied effects of these 4 mechanisms on 96 patients. And those that started with a high LDL, he found that he could reduce the LDL cholesterol by an average of 31%, and in some as much as 52%. And I mentioned earlier that statin drugs sometimes reach the statin floor and you can't lower the cholesterol any further using the statin drug. He also gave BioSlife to a group of people already on statins and found that he was able to lower the LDL cholesterol an additional 20%. So an extremely important niche for BioSlife is in people who are already on statins. It may allow them to break through the statin floor when they can't take a higher dose of the statin. It may allow a lower dose of the statin to be used and thus decrease the potential for side effects. And remember how important I said HDL was? BioSlife increased the HDL by an average of 29% in those with a decreased HDL, and some of them improved by as much as 85%. When I first heard these results, I was really stunned. I honestly never expected that an all-natural, non-prescription product could do something like this. I didn't think it was possible. But I actually know of nothing Not even the most powerful prescription drug that can do this combination of things. Now suppose you decide to take BioSlife and you talk to your doctor. He may not know much about it. And if this happens to you, just tell him to look it up in the physician's desk reference. The PDR is a 3,500-page book that virtually all doctors have on their desk. And it talks mostly about prescription medications and what they're used for and their side effects and so forth. And BioSlife is the only natural, non-prescription supplement in that entire 3,500 pages that does what it can do, which is quite a feat in itself. By the way, I never tell people to stop taking their prescription medications and start on BioSlife. I always tell them to talk to their doctor and then just add BioSlife to the present regimen. And then when they get a terrific result, they can discuss decreasing their statin dose or their diabetic medication or the blood pressure medication with their doctor after that. Now, I mentioned earlier that BioSlife forms kind of a gel in your stomach if you take it about 10 minutes before you eat. So when you actually sit down to eat, you're probably not going to be as hungry. Usually won't eat so much. And often you may lose weight. And actually, BioSlife is an integral part of several weight reduction programs that I'm involved with. And if you lose weight, your blood pressure will usually go down, especially if you do things like I talked about before, like exercise, extremely important. You know, I started my discussion outlining several of the major risk factors for heart disease. Remember what they are? Oh, sure you do. High cholesterol, high blood pressure, obesity, diabetes, and smoking. But if you stop to think about it, I've just talked about how BioSlife can reduce 4 of those major risk factors, haven't I? Namely cholesterol, high blood pressure, obesity, and diabetes. How about the 5th one, smoking? You know 21% of the people still smoke? And smoking is the most preventable of all causes of disease. Will BioSlife help that? Nope, sorry. You smoker just got to get a life, find some discipline somewhere and stop. And if you stop, you can add as much as 14 years to your life. And I believe that BioSlife is made by the best nutritional company anywhere. Unicity is rich in health maintenance tradition, with roots dating back over 100 years. Stuart Hughes, the dynamic and visionary CEO of Unicity, has assembled a hand-picked group of very talented and dedicated people around him to help carry out very effectively the motto of Unicity, to make life better. I admire their diligence, their integrity, their friendliness, and their constant search for cutting-edge preventative supplements like BioSlife. So let me recap. BioSlife is a natural, non-prescription supplement that works by 4 innovative mechanisms to decrease LDL. It may decrease your weight, lower your blood pressure, help control diabetes, maybe even help prevent cancer. Another very important use is in people already on a statin, as BioSlife may allow that person to lower their statin dose, thus decreasing the risk of side effects, while still maintaining their lipids in a safe zone. BioSlife is the only clinically proven, patented, safe, and natural alternative to statin drugs for effectively lowering cholesterol. You know, there are a lot of ways to treat heart disease, and I've seen just about all of them. Most of them are expensive. A lot of them are very painful. Just ask anybody who's had bypass surgery. And some of them just don't work. But the best way, the very best way to treat heart disease is to prevent it. And I've been looking for natural ways to prevent heart disease for over 25 years. And I've never seen a natural supplement I thought was even as remotely as effective as BioSlife for its preventative healthcare potential. So I think BioSlife should be taken by just about everybody that wants to protect their health. But I've been around for a long time. I know only about half the people will take the natural supplements that they know they should take. Which half is it? Is this half on the left? They're smiling, saying yes, and they look pretty healthy. Or is it the half on the right? No, you know which half it is? It's the smart half. The half that first understands that they are at risk and then understands that there's something they can do about it. Prevent it. One of the problems with preventative products is you don't necessarily feel any differently. Your body loves the lower cholesterol. It probably won't know if your cholesterol is high, at least until you have your heart attack or stroke. There's no so-called positive reinforcement. For example, I don't know anybody that gets up in the morning, looks in the mirror and says, wow, I didn't have a heart attack last night. So you need some discipline. But if you have that discipline and do the preventative things you should do for your health, as the years go by and you remain healthy and happy, you can look in that mirror smile, and say, wow, I'm glad I stayed on that road with the smart half. And I can think of nothing better to start and stay on that road to prevention and good health than BioSlife. It may protect, change, even save your life. An amazing thing, you can accomplish this by just taking a packet of BioSlife, stirring it in water, and taking it a couple of times a day before you eat. In closing, I hope I've answered some of your questions about heart disease today, and you now realize that there are significant things that you yourself can do to prevent this killer from striking you. The good news is that you are largely in control of your own health, since heart disease is 80% preventable. The decision is up to you. Take charge of your life and your health. Get physical, exercise regularly, eat smarter, watch your weight, know your numbers. Ask your doctor, hey doc, what's my HDL? What's my LDL? What's my blood sugar? What's my blood pressure? You need to know these things, because when you become aware of a potential health hazard like heart disease, gain the knowledge to deal effectively with it, and then act on that knowledge, you have the power to control your health. And part of this power also includes taking the supplements you need to stay in that smart half. It does what's necessary to remain healthy. And BioSlife is the best, most effective, most complete, most scientific supplement available anywhere. And with BioSlife, you can firmly grasp the true meaning of the power of prevention. I want to thank you for your kind attention today, and I want to wish each and every one of you a long, happy, and healthy life. Thank you.